You know, when it comes to caring for a tracheostomy site, it's all about attention to detail. So today, we're going to zero in on one small but absolutely crucial element that makes a huge difference: the tracheal gauze dressing. We'll look at how its specific design is really all about protecting the patient. So let's start with the big question, right? If you're a caregiver or maybe you're a patient yourself, you have definitely asked this. How in the world do you protect that delicate skin right around the tracheostomy tube? It's a critical, everyday concern.
And that question, it really gets to the heart of what we can call the tracheostomy site challenge. Because you see, it's not nearly as simple as just keeping the area clean. Oh no, there's a lot more to it than that.
Okay, so let's break down the actual risks here. We're not just talking about one single problem. You've got the constant presence of secretions and mucus, which can lead to some pretty significant skin irritation. At the very same time, the physical pressure from the tube itself creates a real risk for sores. And when you put all of that together, the site becomes a prime target for infection.
So because of all those very specific challenges, a general all-purpose solution, well, it often just doesn't cut it. And this is exactly where a specialized solution comes into play. One that's designed to tackle everything we just saw.
So what are we talking about exactly? Well, a tracheal gauze dressing is a specialized, absorbent dressing. Its whole purpose is to provide cushioning and moisture control. The keywords you really want to remember here are specialized, cushioning, and moisture control.
And this is where you can really see the difference, side by side. On the left, you've got your standard gauze. You know, basic shape, kind of one size fits all. But look at the right. You see a specialized dressing. It has a unique shape that's made to fit perfectly around the tube. And the material? It's a soft, non-woven cloth that's so much gentler on the skin. This isn't just a random piece of gauze, it's an engineered solution.
Okay, so we know it's specialized, but how does that design actually help? Well, we can break it all down into three core protective benefits. This is where the smart design really shines.
All right, let's jump into benefit number one. This is arguably the most important job it has.
So its primary function is to absorb secretions and mucus. Now, why is that so crucial? Well, it's all about managing moisture right at the source. By wicking those fluids away, the dressing helps keep the whole area so much cleaner and creates a healthier environment for the skin.
Now, managing all that moisture, that leads us straight into our second key benefit, which is all about prevention. Benefit number two, it helps keep the skin clean and dry, which is absolutely critical for preventing infection. And this is huge. That moisture we were just talking about, if you just leave it sitting on the skin, it can cause breakdown and create the perfect breeding ground for bacteria. So by keeping the area dry, this dressing isn't just about comfort, it's a vital tool for preventing infection.
And that brings us to our third and final core benefit. This one deals with the physical pressure of the device itself.
This one is so important because it addresses the physical part of having the device there. The dressing provides a barrier, a cushion, to avoid irritation and pressure ulcers. Just think about it. The trach tube is a hard piece of plastic resting against very sensitive skin 24/7. This dressing sits right in between, distributing that pressure and stopping the tube from rubbing and causing sores. It's a simple but absolutely vital protective barrier.
Okay, so we've got those three huge benefits. Let's pull it all together. What's the real big picture takeaway here for patient care?
It's really this. The right dressing is not some minor detail. It's essential. It provides that crucial cushioning against the device, it gives you absorption of fluids, and it offers overall protection for the skin. And when you combine all those things, you get a massive improvement in both patient safety and their day-to-day comfort. It's about being proactive with care, not just reactive.
And that kind of leaves us with a final thought to mull over. You know, in the really complex world of medical care, could it be that sometimes providing truly better care simply comes down to choosing the right materials for the job? Something to think about.